There is some important news regarding screenings for lung cancer screenings. Just this month, Medicare approved to pay for those simple yet effective screenings, and that's expected to save thousands of lives.
We're joined now by Dr. George Privett from Lexington Diagnostic Center. Welcome. Glad to have you in today.
Good morning. Nice to be here.
Why are lung cancer screenings so important? And why would somebody say, well, I don't smoke, that shouldn't be an issue for me?
Well, lung cancer screenings are important because, as you just said, they're safe and they're effective. And because Kentucky is the number one in several areas. One is UK basketball, and that's good. The other is the incidence of lung cancer, and they're number one in the United States in the incidence of lung cancer. And those cases, most of them are with smokers. And the important news is that Medicare has been looking at this for a long time, trying to decide whether to approve paying for it. And after a lot of looking and a lot of study, it's been shown that it's very effective deterrent or for detecting lung cancer. And if you can detect it, then it's curable.
So talk about the guidelines for someone who is considering having a screening.
Well, the guidelines for Medicare, in order for them to pay it, you have to have seen a doctor, got a prescription, talked about it, or got an order and talked about it. Also, you have to have been smoking for an equivalent of 30 pack years, or 1 pack a day for 30 years, or 2 for 15 years. And you've got to be age range between 55 and 74. And it's a very easy thing to do, and come in and get it done.
But those rules do presume that you have been a smoker.
That's right. That's right.
Talk about the different scans. Why does a CT scan offer something different from a simple chest X-ray?
Well, a chest X-ray has been very good for a long time. It's because it's been all we've had. But the chest X-ray, basically, you stand in front of a photographic plate, and an X-ray beam shoots at you, and what you see is compressed. The whole body is compressed into one image. The CAT scan, on the other hand, is like taking a cross-sectional image through your body, and you've got a whole bunch of slices. So you're effectively getting a 3D look because you're looking at each slice separately, and you can see very small cancers or tumors or nodules.
All right, so it increases the effectiveness then that way.
It does indeed.
All right. Well, we appreciate you coming in very much today.
We do. Thank you very much, Doctor.
Thank you for having me.